Greetings from Aster RV. I am Dr. Rashmi. I am a pediatric surgeon at Aster RV, JP Nagar, Bangalore. And today I would like to talk to you about urinary tract infections and how do you identify the symptoms in children. Well, you may know that most of the adults present with urinary tract infection in the form of burning, micturition, fever, lower abdominal pain, children may not be as comfortable explaining to you what are the symptoms. So how do you identify if your child has urinary tract infections? First is there could be unexplained fever. Second, the baby tries to pull or tug at his penis or the genitalia whenever he is passing urine. 3, there could be foul smelling urine, very small quantity, frequent urination, or there could be urgency in urination if the baby is quite old enough to tell you. So in any of these situations, please consult a pediatric surgeon, because most often you may think that it is easy to manage with antibiotics, which may be true in most cases, even especially in adults, but in children there could be underlying congenital anomalies which need further workup. This is not as easy as saying every child with urinary tract infection may have to undergo evaluation, but it is always best to consult a pediatric surgeon to rule out underlying issues. The issues mostly can be in the form of reflux. Reflux is, when we talk about urinary system, we are talking about 2 kidneys, 2 ureters, a bladder and a urethra. As long as the urine is reaching till the bladder, it is considered sterile. If it stays there too long, it can get infected. And this infected urine, if it goes backwards, which is not supposed to, if it goes backwards, it can cause trauma to the kidney and in the long term can cause even renal failure. And that's why it's very important to address this issue as soon as possible. When we say as soon as possible, antenatally when you get a scanning done, it can pick up any congenital anomalies of the kidney, ureter or the bladder. And if there are problems like that, don't even wait for a urinary tract infection to happen. Consult your pediatric surgeon as soon as the child is born. If you hadn't identified any issues like this antenatally, do consult whenever there is a first episode of urinary tract infection. Even though there are set protocols to when to intervene and when to do any invasive procedures, it's always best to discuss. For any further queries, do consult us at Aster RV Hospital, JP Nagar, Bangalore. From antenatal counseling to surgical management of a newborn, from congenital anomalies to acute emergencies, from trauma to tumor, for any help that you need, we are here. Thank you.